Hi, I'm Shalini Bharadwaj. You all are watching ITV Network's Medically Speaking. In our last episode, we discussed about the impact of second wave of COVID-19 on India. And today we are going to discuss about the impact of COVID-19 on diabetic patients. We have with us on our panel Dr. Nikhil Tandon, who is a senior and head of the department endocrinology at All India Institute of Medical Sciences. Sir, welcome to Medically Speaking. We have with us Dr. PANKAJ AGGARWAL, who is a senior endocrinologist. And we have with us Dr. ASHOK, who is a chairman of Delhi Diabetic Research Center. Sir, welcome to Medically Speaking. Sir, my first question goes to Dr. Nikhil. Sir, what is the commonest form of diabetes?
Commonest form of diabetes globally in here will be what previously was called non-insulin dependent diabetes and what we today call as type 2 diabetes. Maybe 85% or even more of all people with diabetes have this particular disease, which in earlier years used to be starting in the 30s, 40s or 50s and was invariably associated with being overweight and invariably responded to oral medication. The part about responding to oral medication still remains very much intact, but unfortunately, the age at which it is starting to appear in our population has progressively become less and less with passage of time, so much so that even people in their late teens have now started developing this particular problem.
Sir, why Indians are so much prone to diabetes?
So again, I think you need a little bit of a historical context for that. There's a very often repeated study or an editorial from the journal called Lancet. Now, people are now familiar with the name Lancet because of COVID. Lots of papers come there, which in 1907, that's about 115 years ago, said what gout is to the aristocracy of Britain, diabetes is to the aristocracy of India, suggesting that this is a disease of the affluent, the disease of the rich, the disease of people who ate and put on weight, right? Over a period of time, that has clearly changed, right? With improvement in development indices, a disease which seemed to have been restricted to the extreme right of the socioeconomic curve has now spread across. We possibly have a genetic predisposition. We were not exposed to an environment or eating habits or lack of exercise before. Now that we are possibly with the same genetic exposure, also getting adverse environmental exposure, the disease is becoming progressively commoner. It is, by putting on weight, eating the wrong food and exercising very less, people who are predisposed are obviously getting this disease.
Dr. JHINGAN, sir, what are the common symptoms of diabetes?
That's a very good question because many people are not aware. So the commonest symptoms are excessive thirst, excessive urination, excessive appetite, or and then the loss of weight. These were the four things which were quite common earlier, but now so many people are coming with the symptoms, which is a fatigue, excessive tiredness, weakness, letharginess, sometimes itching all over the body. And many times, that's why we always say it's a silent disease because people, they are not having any symptom. They are going for some executive health checkup, or those people are going abroad and then they get a examination, routine examination, it is seen. But generally, large number of the people who are hypertensive, people who are overweight and obese, as Dr. Nikhil Tandon has said, they all are prone to develop a diabetes, and these symptoms are quite common many times in the males and the females, itching at the private parts. That's one of the important manifestation by which the person goes for a investigation, and then it is found that he or she is having a diabetes. So these are the various symptoms are there. Other symptoms, like many a time the young girls who got married, they are not getting pregnancy, or they are having a frequent abortions. Then when they get an investigation, then it comes to know that they are having a diabetes. So these are the various manifestations of this disease, but classically those four symptoms which are there: excessive thirst, excessive urination, hunger, and at the same time loss of weight.
Sir, what are the common types of diabetes are there?
I think as Dr. Nikhil London has said very clearly, there is a type 2 diabetes, which is about 85%. Then there is a type 1 diabetes, which is about, we can say about 10% of the patients are there. Then, of course, there are the different type, but classically, then third variety is the gestational diabetes. And then again comes the nutritional which is seen in Odisha, and that pancreatic diabetes. These are the different type of the diabetes are there. But classically, or when we say three main classical groups are there: type 1, type 2, and a gestational diabetes, which is again becoming a very common nowadays.
Dr. Pankaj, sir, India has an estimated 77 million people with diabetes, which makes India second most affected in the world after China. What is the reason behind it, sir?
Yes, this is a real big issue for us Indians. And at one time, we used to top the list in the world. We were said to have the maximum number of diabetics all over the world. Now, China is heading this list. So it's unfortunate to be on the top. The reason has been mentioned by Dr. Nikhil that we are genetically predisposed, that is one, but we were genetically predisposed for pretty long period of time. What happened in recent years that it has manifested in terms of diabetes is our change in lifestyle. With modernization, with urbanization, we change from our active lifestyle to stress living, we change to our sedentary lifestyle, mental stress, superseded by these, like in this COVID era, the infection at the top. So all these things are basically bringing this problem earlier in our life and increasing its incidence. As Dr. Jhingan has said, I wish to phrase the same thing in a different language. The commonest symptom of diabetes is having no symptom. So most of our cases are asymptomatic. Probably there was lots of patients we were having initially as well, which were undiagnosed. Now, with improved diagnostic techniques and more awareness about the disease, we are detecting quite a good number of those patients which were previously undetected. So, genetical predisposition, our change in lifestyle, superseded by mental stress, and if at all there is any physical stress in terms of infections and other things, then that has led to the increased prevalence of diabetes in India, especially in recent days.
So, can COVID-19 cause diabetes?
COVID-19 cannot cannot cause diabetes by itself. Basically, it is with any stress, physical, mental, in terms of any injury, in terms of any infection, like pregnancy is a stress on the body, so it predisposes likelihood of diabetes. Similar is the way with COVID. So COVID infection may precipitate diabetes in predisposed individuals who are already having some increased chances of having diabetes. Secondarily, being a more precipitous form, more a severe form of infection in some individuals, it imposes a severe stress. We use some agents like glucocorticoids to prevent certain complications of this infection in many individuals. The use of those glucocorticoids also increases likelihood of having this diabetes. So basically, COVID doesn't lead to diabetes. It is the stress caused by COVID infection and use of some medicines to prevent its complication that leads to diabetes in many of such patients.
Dr. Nikhil, sir, how it has affected diabetic patients, COVID-19 pandemic, how it has affected COVID-19 patients?
I think this is an important message we have to communicate, and thank you for asking. So I think, what Dr. Pankaj Aggarwal said, that if I have a tendency towards diabetes or have pre-diabetes, infections will then cause unmasking of that diabetes, that becomes there. That's one side of the story. The other side of the story, which is equally important, is supposing a person with diabetes develops COVID infection, what do we need to be worried about? We need to be worried that a person with diabetes who gets COVID is much more likely to have serious disease, is much more likely to require hospitalization, is much more likely to require intensive care, and unfortunately is also much more likely to die as a result of COVID, as opposed to a peer who does not have diabetes. So that's the first thing. The second thing, a person who has diabetes on exposure to certain drugs, which are now an essential part of the treatment of COVID, will also have worsening of their sugars. As a result of that, they will need much more aggressive management of diabetes. The third thing also is there are now two categories of people you need to understand. Those who we already knew who had COVID, right? And then they developed, people who we knew had diabetes and then they developed COVID. So we are a little warned and we can take appropriate measures, right? But there are also that group of people which Dr. Pankaj mentioned that they never knew they had diabetes. But during evaluation for COVID or during the treatment, it was recognized that they actually do have diabetes, which they did not know about. That is an even more dangerous subgroup because they may not get even treated appropriately because you never knew that they had diabetes. So the plea to everybody is, if you have diabetes, stay well controlled, because then your likelihood of catching the infection becomes less and your doctors will be able to treat you much better. And for the doctors, the message is that anybody who comes to you with COVID, please measure the blood sugar, even if they are not known to have diabetes, because you may have an previously unknown person with diabetes. Okay. And if you catch them at the very beginning, you can be more aggressive in the way you manage their COVID and also aggressively manage their diabetes. So the message is for people known to have diabetes and the doctors who treat COVID. Both of them need to understand these principles, and that will help us in this fight against COVID.
Dr. JHINGAN, sir, what are the latest treatments which are available for the treatment of diabetes?
Of diabetes, there has been a much now improvement, but the basic thing remains that the lifestyle change. Because as Dr. Pankaj said very clearly, and Dr. NIKHIL Tandon also very well stressed about that, the change in lifestyle. So the diabetes is a lifestyle. This genetic background gets precipitated with the environmental factors like change in food habits, change in lifestyle, that means sedentary lifestyle, and then it gets aggravated because of a physical and a mental stress. So coming to the diet part, there has been the same thing that the diet has to be a balanced diet. There is nothing like a diabetic diet, but this to be a balanced diet, which will help him. Most important part all over the world today is, and what was, I think the main fear is that the large number of those people who are pre-diabetic, they will get converted into diabetic. So it's just 7 to 10% of a weight loss. That's a main criteria, and that can only happen with the exercise. So exercise is a very important part of the treatment strategy. 50 minutes of a regular exercise is to be done. Then comes the oral medications. There had been a paradigm shift in the management part. There has been a different type of the class of the drugs. Now there are very good drugs have come, which have a good control, but there is again a limitation on the part of each group. So now we have plenty of drugs looking after the various pathways by which the diabetes happen. And these drugs are quite effective. And once these drugs also, with all these things, if we are not able to get our target levels of HbA1c to 7%, that means we have to now try to the insulin. And again, in the insulin category, I think Dr. Pankaj as well as the Dr. NIKHIL will agree. Now we have all those latest analogs are there, very good available insulins are there, which helps in a very good control of a diabetes. So the thing is that we move gradually from a diet, from exercise, medication, and going on to the insulin part. And then there are different type of the regimes are there by which today we are in a position that we can keep the blood sugar levels around 7% HbA1c. And why this is all happening and why everybody is concerned is that to prevent the complications, because more is the HbA1c, there are more chances of complications of diabetes. So this is a concern for everybody, that with these latest available medications which are available now and the insulins, we can keep the blood sugar under control.
Dr. Pankaj, sir, how gene therapy can be useful for diabetes? Are we doing in India gene therapy?
This is still in investigational phase. So therapy is very promising, no doubt. The problem lies with type 2 diabetes is that there is no single gene which is leading to development of type 2 diabetes, which happens in adults, which is happening in around 85% of cases of diabetes. So for type 2 diabetes, for the major chunk of diabetic individuals, there is no single cause which is leading to diabetes. There is no single gene which is leading to diabetes. So by intervening with one gene only, we cannot cure it. So type 2 diabetes gene therapy is dur ki kaudi.
Okay.
It's a far thing to happen. But for type 1 diabetics, yes, there are certain things which are promising, not exactly in terms of gene therapy, but otherwise the damage which is being inflicted in the some target areas in type 1 diabetes, those can be prevented to a large extent by some interventions, by interfering with the immune mechanism of the body. It can be changed by pancreatic beta cell transplantation or stem cell therapy. So those things which are possible rather than directly going for gene therapy, especially in type 1 diabetes, and stem cell therapy probably may come up in future with type 2 diabetics as well. So those things are more promising than directly going for gene therapy.
Dr. Nikhil, so do we have some kind of permanent solution for diabetes? Because if somebody gets diabetes, he or she thinks that why can't we treat? And because the treatment which is available, that is long life treatment.
I think you have to understand, I think those are important principles which people have to understand. Doctors have to understand and the patients have to understand that there are two broad categories of disorders, right? The communicable diseases, the infections, which are amenable to cure, and the non-communicable diseases, which by and large, except for certain cancers, which can be eradicated with surgery or with appropriate other therapy, are not cured but controlled. Right? And I think we have to understand that the way treatment is done for one category versus the other category is different. The aggression which needs to be done is different. One is running a 100-meter race and trying to finish everything off. Somebody has an episode of pneumonia, you treat, you cure. That's it. COVID, you treat, they become RT-PCR negative. That's cure. They possibly had diabetes before they got COVID. They had diabetes during the time they had COVID. They will continue to have diabetes after they have COVID. So the mental approach to this has to be very different. We are trying to control these disorders, whether it's blood pressure, whether it's heart disease, whether it's diabetes. These are for control and not cure, with our available understanding of what is responsible for them and our available medication. I think Dr. Pankaj also told you that even we're not even thinking of things like gene therapy definitely in type 2 diabetes. It's possibly a polygenic disorder. Same goes for actually type 1 diabetes. So I think patients have to understand that if there will be a cure, the doctors will definitely tell them that there is a cure. And they will do that. Till such time that the doctors have not told them there's a cure, they have to understand that they have to do, with the assistance of the doctors, their very, very best to control things. So the mindset has to be changed. It's not an acute, finite care. It is a chronic care disorder. And we have to manage and pace ourselves accordingly and treat ourselves accordingly. And you have to reconcile to that with the available understanding. as I said, if things change tomorrow, a cure comes to these disorders, I guarantee you that the doctors will be the first one to tell the patient, we have a cure.
True, sir. Dr. Pankaj, sir, if diabetes is not treated timely, then how much chronic it can be?
Yes. The problem of diabetes, the brunt of diabetes, the significance of diabetes lies in the complications which are produced because of it. If somebody is having, like Dr. Jingan has said, that most of the patients, they don't have any symptom, they
They
are
are
detected
asymptomatic.
incidentally during their routine checkups. So if a patient comes with a sugar of, say, 500 and having no symptom, so 500 sugar is not going to kill that patient. It is the complication, it is the impact of that 500 sugar which is kept there for a long period of time on our body systems, which kills us, which matters us in terms of our morbidity, the symptoms, the complications which are produced because of that. So blood glucose going to 500 level, living there for 1, 2, 3, 4, 5 days is not a problem. But a glucose level of even 200 living there for an year is definitely is more injurious. It will create more impact on the body. It will affect many of body systems, and it will be a problem forever. And once anything happens, once a target organ is damaged, anything in the body is damaged, the God has not provided us with any stepney. So we have got only two wheels in our motorcycle, and we have to live with that. So each and every organ is unique, and once damaged, it can't be repaired. So we have to maintain glucose level in its normal limit throughout the life to protect those organs, and the symptoms or the features associated with these organ involvements are unique with their own setup. Like for eyes, it will be blurring of vision, reduction in visual capacity, acuity, and blindness at the end. With kidneys, reduced urine formation, swelling over the body, and then later on kidney failure. With nerves, feeling of burning, sensation of cold, not feeling anything, sense of ants crawling on the feet, pin pricking sensation, and later on developing frequent ulcerations and gangrene and leading to amputation of limb. With heart, pain, breathlessness, heart attack. With brain, stroke, paralysis, and all these things may happen, but they happen because of continuously raised glucose levels, which needs to be tackled in its earlier stages. Once it affects an organ of the body, nothing will change, nothing will cure, as Dr. Nikhil has said. It won't lead to cure of that problem as well. Even if you lower down, even if you normalize glucose levels thereafter, once destroyed, it will be destroyed forever. So our duty is to treat diabetes, to control diabetes, to prevent these target organ damage, which may happen in future.
Dr. Jhingan, sir, please give 5 tips to manage diabetes.
The first thing is that they do regular exercise, 50 minutes of regular exercise to control the stress, meditation, and yoga. About the diet part, you must do a regular sort of a balanced diet. There is nothing like a diabetic diet. There is nothing like a diabetic atta or anything like that. And of course, no diabetic sweets and all that. So then the diet is the same. The third is the regular intake of medicine. That's very important. Fourth is a regular monitoring. I think everybody insists on that. There are patients who are just doing the blood sugar once in a month, once in like that, and then they don't know what is the status of that. So regular monitoring is the key to the successful management of a diabetes. And fourth, and the last but not the least, is adhere to the treatment. Adherence to the treatment, not change your treatment as per the saying of the other persons, that the regular treatment will make you absolutely under control. And as Dr. Pankaj has said, and we all agree to that, prevention of a complication is the most important, because that's the biggest, that will be a burden to the people today. As such, the expenses for the treatment, but once the complications are developed, then it's a very expensive phenomena. So, right, the person who know about his diabetes, he can live longest. That's the main thing. Awareness and education is the cornerstone of the treatment of a diabetes. That's a very important aspect.
Dr. Nikhil, sir, people still are not that much aware. What message you would like to give?
I think let me go back to a statement which Dr. Pankaj said, that the most common symptom of diabetes is a lack of symptoms. And so I think the message has to be, and I must applaud the government of India for this, the message has to be that after a certain age, people should periodically get tested for diabetes or blood pressure, right? Because especially in type 2 diabetes, you can end up with a situation that somebody may have had diabetes for a long time without symptoms and reach medical attention only after they have developed a complication, which is the worst thing that can happen, because then the doctor will say, you already have a complication, we are unable now to rectify that. So the first message is periodic, once a year, once in a couple of years, you must get your sugars checked, you must get your blood pressure checked, so that you are identified early and your treatment starts. Secondly is the awareness, if your parent has diabetes, both parents have diabetes, some uncle or auntie has diabetes, it means that there is a problem in the family. So they should actually get themselves checked even more frequently, because the likelihood of them having diabetes obviously is more than another family who doesn't have diabetes. Thirdly, women who get gestational diabetes, let me say that again. Women who get pregnant must get checked for gestational diabetes. You know, it is mandatory, but it's not done very often. And any woman who is found to have gestational diabetes not only needs to be treated during pregnancy, but has to be followed up after delivery also, because these women are at a much higher risk for developing diabetes later on in life and still at a very young age. So I think the message has to be, you need, because it's an asymptomatic disorder or can be asymptomatic in a significant proportion, you need screening. You need screening, and you need to incorporate healthy lifestyle right from childhood. You know, it's very difficult if you are in the business of having fried food, puri paratha, that at 40 years of age or 50 years of age, to change your dietary habits is very, very, very difficult.
That's
So
important, sir.
bring healthy habits, regular exercise from the very beginning, good habits for eating from the very beginning, so that you don't encounter this. You are much more likely, even if you are predisposed, you are much more likely to postpone the development of diabetes, and B, you will be able to handle it that much easier. So and as Dr. JHINGAN said, there's no like diabetic diet, heart diet, blood pressure diet. There is a good, healthy, balanced diet, good, regular physical activity. These should be part and parcel of our living from day one, and not only after we develop a disease.
Thank you so much, sir. Thank you, Dr. Pankaj. Thank you, Dr. Nikhil, Dr. JHINGAN, for sharing such a important information with Medically Speaking. Thank you so much, sir.
Thank you. Thank you.